Hello, everyone. Good morning, good afternoon, good evening, wherever you are. Welcome to Meet Menaca, celebrating you. Today, we are welcoming you to the episode 45, Nourishing Brain Health with Arani Nitkunan. And she is a specialist in her field. Couple of things. First thing is, most of you have requested us to do this on a Sunday. So we are definitely considering it starting from next month, just for the summer to begin with, and then we will see how it goes. So thank you so much for continuously giving us feedback and suggestions, and we will ensure that we'll do all that we can to accommodate your requests. The second thing is, if you find these lives or the YouTube useful and valuable in making change, please do subscribe. We are humbled and honored to have Dr. Arani Nitkunan. She is highly educated, and so we are really humbled to have her. She has her FRCP and PhD. She's a consultant neurologist and in Croydon University Hospital and St. George's University Hospital in London. She studied at Newham College, Cambridge, and Guy's and St. Thomas Hospital. She graduated in 1999. She was awarded a PhD for stroke research at St. George's Hospital, London in 2007. Dr. Nitkunan was appointed as a consultant neurologist in 2013 with general neurology clinics at Croydon University Hospital and a specialist ophthalmology clinic at St. George's. Her two subspecialist areas are stroke and neuro-ophthalmology. She was appointed clinical lead for neurology at Croydon in 2015, where she has transformed acute neurology and driven the appointment of 5 nurse specialists. She's a council member of the Association of British Neurologists since 2018. And also she is sitting on the Quality Committee and the newly formed Equality, Diversity and Inclusion Committee, chair of the Southwest London Neurology Network since 2019, and appointed as the trustee on the board of Neurological Alliance in 2020. And as ever, we know brain health is one of the most important things for everyone to know. According to WHO, brain health is an emerging and growing concept that encompasses neurodevelopment, plasticity, functioning, and recovery across the life's course. So I can't wait to learn and listen to Dr. Arani Nitkunan today. A very warm welcome to you, Arani.
Thank you so much, Menaca, and thank you to Dr. Kanda Niranjan for inviting me to speak today. I feel very privileged to be here, so thank you.
Before we dive deep in and learn more, can I ask you, what is brain health for the audience who perhaps doesn't read or learn or listen too much into brain health?
So let me break it up a bit. So if you think about the 2 words in brain health, so there's brain and there's health. So I'm very biased. I think the brain is the most amazing organ in our body. It's complex. We all need it to do everything in life, really. It's utterly fascinating. It's I try and think of brain as controlling 2 different types of actions. One is the sort of automatic ones, and the more voluntary ones. So it's involved in automatic things like breathing, going to the toilet, sweating, all those things, as well as the voluntary things like me moving my hands around and speaking to you. Mm-hmm. So we need our brains to do all of these things. And health, well, I think of health as trying to reach our potential to do what we want to do every day of our lives. And, we need our brain to function at quite a high level to be able to achieve that potential. So that is how I would define brain health. And I like the term brain health. So thank you for, entitling this talk as brain health, because it's such an optimistic, positive term. It's health, it's not disease. And I like that concept, that we focus on what we can change and what we can do to help ourselves.
Sure. Thank you. I think we all have to learn to nourish our brain health because we are living longer and longer. And I think it's becoming more and more important. So thank you so much for that. So I think, you touched upon, what is brain health and why we need to focus on that. So I think good brain health is, for me, it is like, we all can realize our, strengths or abilities or, emotional, psychological functionings and how we behave in different life situations. And it is, as you said, is one of the most complex organs as well. So why do you think we need to nourish the brain health as an expert, Arani?
Well, if we think at a very high level, so if we think from a global perspective, the burden of disease, brain disease, is actually very high, especially in low and middle income countries like Sri Lanka and India. It's sort of 70% of the disorders there are due to brain disorders. And if you look at the leading cause of disability, it is because of a brain condition. So that's one of the reasons why I think we need to think about the brain in a very serious manner. And of course, the next thing is about death. So, we think about mortality and morbidity, so death and illness. So as I said, disability it's a second leading cause of disability. But when you think about death, it's the second most leading cause of death. So from a global perspective, it's a huge issue. And therefore, this is why actually I am here talking to you, because I want to think about it from a very individual and personal perspective, because that's where we all start, isn't it? We all start in our own homes, of trying to deal with the things in our own homes before we go out into our communities, our countries, and then of course globally.
Sure. Thank you, Arani. So, it's fascinating to hear you, how passionate you are, it comes across as well. Because particularly with the pandemic, we all know how interconnected all these things are, isn't it? Whether it is individual families or socially, but they say the biological determinants like genetics play a role in brain development, and in brain health, there are different preconceptions, and we all need to somehow influence the way brain develops or adapts or responds to stress and adversity and challenges, isn't it? Like with different strategies. But you also then have brain disorders. So can you tell us what are the commonest brain disorders, Arani?
So the most common condition is stroke.
Okay.
So if we had to group all the brain disorders together, just about 40% of them is due to stroke. And so I'm sure all our audience knows about stroke, but for some of you who may not know, if I can explain what stroke is, because it's incredibly common. And you may in fact all have a friend or family member who has unfortunately suffered from a stroke. So stroke, if you think of your blood vessels like pipes going to your brain, it's when those pipes fur up and the blood supply to a particular part of the brain gets blocked off. And that can happen suddenly, which is why it's called a stroke, because it sort of strikes you down. And that can cause all sorts of problems. So it depends really on which part of the brain is affected. So it can affect your speech or your weakness or numbness and all sorts of things. So stroke is the most common condition and can be incredibly disabling, and in fact, unfortunately, can cause death as well. Some of you may have heard of the term TIA, which is transient ischemic attack, which is like a minor stroke. So it's essentially a stroke that lasts for less than 24 hours. So if we move on from the most common cause of a brain disorder, which is stroke, to the next most common disorder, and actually that's migraine. So migraine is the most common cause of headache. And I'll put my hand up. I have migraine. And it's a very common condition. Yes, it can be worse when it's when you don't eat regularly, you don't drink enough water, you don't sleep properly, if you're very stressed, then you can get more and more migraines. It does tend to run in families, so you can always blame your parents, another thing to blame your parents for. But it can, we can help manage the frequency and severity by doing things in our own lives to try and manage it better. But that's the second most common brain disorder. And then the third most common brain disorder is dementia. Again, very common. All of you would have heard of that. Essentially, memory difficulties that is usually slowly progresses. It usually happens in older populations. And the most common cause of dementia is, of course, Alzheimer's dementia. That's more difficult. It's not so treatable, unfortunately. And then when you think from a global perspective, what's the fourth most common neurological or brain disorder? That's actually meningitis. So it's not so common in this country, but in low and middle income countries, meningitis would be the fourth most common. And then, of course, the fifth and the last one I'm going to mention is epilepsy, which is seizures. So that is a condition that only affects people for a few seconds or minutes, because the seizure can be quite short lasting, but it has a huge impact on people's quality of life and function. So those are the five most common brain disorders.
Thank you, Arani. So, there is a lot of talk going on about neurodevelopment and neurological conditions like, how we intellectually develop the, autism or autism spectrum disorders or cerebral palsy. It's like so much has been talked about, and Parkinson's is another thing, because we even had a talk on a survivor of Parkinson's who, so, where do they sit actually? I'm just curious to know, where do they sit in the brain health spectrum?
So Parkinson's disease, actually, I think it's the next one down on the list, actually. Okay. It's the sixth most common. So autism, cerebral palsy, they're all neurodevelopmental disorders. Mm-hmm. And actually, again, it's potentially more common in low and middle income countries. They are, again, less common than that, but they will come in the top 10. Sure. So yes, and it's it's due to issues with development when you're as the baby is developing in the womb, is when you have sort of things like cerebral palsy. Now, autism, it's multifactorial. It's the jury's still out about all the things that are potentially implicated in causing it. I tend not to see it myself because I'm an adult neurologist, but sure, my pediatric colleagues would see that more often.
Sure. Thank you so much, Arani. So, I know you have immense experience in this field, and you have taken several roles and done several things. Can you tell us about a memorable patient who stood out for you?
Yes, I can. There are so many memorable patients, actually, and that's the one thing I feel really lucky about being a doctor, is that patients share their feelings and their thoughts, and it's a very privileged position to be a doctor. But I think the one that I might highlight to you today is a young man who was Afro-Caribbean, who came into hospital. He was in his late 20s. He was at work, and this is actually when I was a trainee, when I was a registrar, so it's almost 10 years ago. Time flies when you're having fun. And he came into A&E because he had sudden onset weakness down the right side of his body. So he had a weak right arm, right leg, and weak face, and he couldn't speak very well. And his colleagues at work had called the ambulance because they were worried about him. Mm-hmm. They knew that he suffered from migraines, and they were wondering, is it a migraine? Because you can get migraines with auras, but they were worried enough to bring him in. And when I examined him, he was really quite densely weak down the right side and really couldn't understand what I was saying and couldn't speak properly at all. When we did the brain scan, he had very subtle changes. We could see a clot in his blood vessel. So you remember me saying about strokes and it being like, if you think of your blood vessels like pipes and it's a blockage of that pipe, you can actually now with imaging see that blockage. And it's now 10 years since I saw this patient. And at that point, we were just having evidence coming out that a treatment called thrombectomy was very, very potentially very helpful. Now, it is now well established that thrombectomy is helpful. So let me just explain what I mean by thrombectomy. So thrombectomy, so thrombus means clot, and ectomy means basically taking out. So you basically take out the clot, you go in through the groin with a little wire. The interventional neuroradiologists do that, so it's not me, but they go in through the groin, in through the blood vessels, up into the brain, and then literally pull the clot out. And I remember this patient because I went in at that point, thrombectomy hadn't been established, but I felt because he was so young, we really pushed for him to have thrombectomy, even if it wasn't established at that point. And I went in and saw that surgery, and I saw the clot come out, and I was so overjoyed because I thought hopefully he will recover better. And we know that with thrombectomy, people do have a much better outcome. And he left the hospital a few days afterwards, being able to walk with a bit of speech, and hopefully with time he did improve. Not unfortunately back to how he was, but much better than he would have if he had the clot in him. While I'm actually talking about him, the other really good advance is thrombolysis, which is this clot busting drug, which if you have a stroke, I don't know if all of you have seen these posters. Actually, you may have seen these posters called FAST, which says face, arm, speech, time.
Sure.
And essentially, if people have problems with their face or arm or speech, then time is of essence, because we can only give this clot busting drug if they come within 4.5 hours of onset of their symptoms. So you really have to call an ambulance quickly, get them to the hospital, and then we see them very, very quickly. And then with thrombectomy, again, a small cohort of patients with stroke may be able to have a thrombectomy now. So I learned a lot from that patient because, we managed to move very, very quickly and hopefully improved his outcome.
This was, this was not planned at all. But when I was sitting and listening to you, I suddenly remembered more than 30 years back, my father had a small accident, and he's a doctor. So one day in the morning, he couldn't put his, he was struggling to put this button. And he just told my mom, I think I have a clot. I have to get admitted. So they got him to Colombo and got admitted. And I now know, listening to you, it was perhaps a thrombectomy, which was done at the time. I didn't know, because all I knew is I was doing dentistry at that time. I was in Bangalore. They didn't even tell me till it was afterwards. As parents, they want to protect their children. So all I heard from my mom is they drilled the skull and, got in and did something. Years later, a few years back, 3-4 years back, he had a mini stroke, but it was not for 24 hours. So it was more TIA. This was not TIA, but I think within a few weeks, if not months, he definitely recovered back. So do you hear these things? Once if they have it, do you think those people are more prone to have full-blown strokes later? Because he never had the stroke. It was just that sign, symptom of not being able to put his button. And I think because he's a doctor, he picked up on it.
So I can't comment on your father's case because I don't know all of this details. However, generally, if you have one, what we call vascular event, in other words, you've had a mini stroke or a stroke, or even if you've had a heart attack, or you had blood flow problems to the legs, you are more prone, unfortunately, to other events. However, this is where I think I'm a cup half full person rather than a cup half empty person. And I kind of think, well, this is the opportunity to try and address it. And this, you can change outcomes by changing your lifestyle.
Sure.
So, the things that you can do are, hopefully no one in the audience is smoking, but if you're smoking, please stop. If you, drink alcohol, then you shouldn't be drinking every day. You should have a few days when you're not drinking alcohol, and you shouldn't drink more than, a glass of whatever it is that you're drinking every other day. And if you have high blood pressure, you should be controlling your blood pressure by taking your tablets. And it's the rule of halves in blood pressure. Half of the population don't know they have high blood pressure. Half of those who know they have blood pressure are not on tablets. Half of those who are on tablets are not controlled and therefore need more tablets. And I think, most of us in a perfect world would love it if we didn't have to have tablets for anything. But I would strongly urge everyone listening that if you have high blood pressure, please control it, please take your medication, because it is a modifiable risk factor. You can modify your risk and reduce the chance of having a stroke or heart attack by controlling your blood pressure. Other risk factors are diabetes. So ensuring that you take your tablets and control your diabetes, controlling cholesterol, exercising. These are all things that you can do to reduce your stroke risk.
Sure. Thank you, Arani. So it is important. I often say when I'm sitting here and listening, I don't have any excuse not to exercise, because people come, again and again, they can tell the same thing. I can't even tell that I did it here. So thank you so much for that. You have told all the things what we can do to prevent the problems with the brain health. Would you be able to tell us how we can improve the brain health? Because I think, if we have had whatever lifestyle we have had here and now, what can anyone do to improve their brain health going forward?
And I think this is a really important question, Menaca, because the brain is the only organ we can't transplant. Okay, so we really have to look after it. There's no second chance with the brain, unfortunately. We can't turn the clock back. We can only look forward with the brain. So we have to try and do all that we can to protect our brains. So if I can say 5 things, they are: number 1, exercise. And so what do I mean by exercise? And I know probably when my children were very young and I had even less time than I do now, it's really hard to do exercise. But now I try and combine it with other things, so that I go running with my sister. So we have a little gossip at the same time as running. And I'm now, since with lockdown, since my husband's working from home, I now go for a run with my husband as well, and actually get a chance to talk to him as well, which is a bonus. So I think it's carving out the time and sticking to that very boring routine of putting the time aside for your exercise. And the Department of Health suggests that you do 30 minutes of moderate exercise at least 3 times a week. And by moderate exercise, that's even a brisk walk. And, if you don't feel like going outside because it's a rainy, horrible day, then if you go to YouTube and just Google exercise video, you'll come up with so many options. You can find whichever one you like. And, I would recommend that if you have grandchildren or children, do it with them. You can't start too young, really, of starting exercise. So number 1, exercise, exercise, exercise. Number 2, sleep. So sleep is really underrated. We have such busy lives, and we think that sleep is the one thing that we can get rid of, and we cannot. Our brain needs that time to rest, form those memories, make those connections between our neurons and our nerves. So sleep is incredibly important. And yes, as you get older, your sleep might be slightly different, a slightly different pattern. If you're a teenager, it might be a slightly different pattern. But that doesn't mean to say that you shouldn't have a good sort of 7 hours at least, potentially 8, potentially 9 hours of sleep. So number 2 on my list would be sleep. Number 3 would be diet. So I think most of your audience are Sri Lankan, is that right, Menaca?
Definitely Asians, most
Yeah,
of
okay.
them
So
Asians.
actually,
South Asians, yeah. So.
Okay, so traditionally the Asian diet is actually a very healthy diet. However, I think we've all become not so traditional, and the newer variations of our diet, some people have moved more towards an unhealthy diet. So I think what is usually suggested is what we call a Mediterranean diet. So fish, vegetables, not so much carbohydrate. In a few years ago, you would have all heard the sort of having 5 a day, so having 5 portions of fruit and vegetables a day. It's now gone up to potentially even 10 portions, which, when you have your rice and curry, it's making sure that the rice portion is the size of the palm of your hand, which is not very much, but having lots of curries, and hopefully kind of like a rainbow of colors of curries, because that means that you're getting the whole spread of all the vitamins, etc. So just to recap, so exercise, sleep, diet, and then staying mentally active. And I think, with lockdown, that's been quite hard initially, when all of us have been getting used to this new horrible lockdown lifestyle. And I'm very grateful to people like you, Menaca, who have kept everyone going, and all the charities and elders groups who have put in so much work and effort. They've been absolutely brilliant. There've been some really hardworking people. I can see some of the names out here now, who have put so much effort into ensuring that people are kept mentally busy. And actually the 5th thing was to remain socially involved. So both these things they have done incredibly well during lockdown. And I hope these are one of the lessons that we take past lockdown and past COVID. Because I think, if you keep your brain busy mentally and socially, it will protect it in the future.
Sure. Thank you so much, Arani. I'm sure we all are going to take these things on board and try our best. So, like you mentioned, so we are all social beings, isn't it? Like, particularly with lockdown, we haven't been. Do you think social interactions are also kind of underrated when it comes to brain health?
Absolutely. And it's been very sad. People who have been in care homes in the last year, and because of COVID haven't had the visitors that they usually have, you can see the change. Because their loved ones haven't been able to visit, they have not been able to have those interactions which would keep their brain ticking away. So social interactions are incredibly important, and I'm very pleased now that the government has relaxed those guidelines and that we're all getting vaccinated, which keeps things safe for our elder members of our community in the care homes, and that we can actually now visit them safely. But even if they're not in care homes, even actually there's some studies, I remember reading quite a few years ago, in Asian families sometimes that there's multi-generations within one household. And you would assume that because it's a multi-generational household, the elder person in that household is actually not socially isolated. But that is actually sometimes, unfortunately, not the case. And even though they are in the household with other people, they are quite isolated. So again, a very hard thing to do, but trying to carve out a little bit of time in our busy lives, even if it is half an hour a month, half an hour a week, whatever it is, to put the time aside to go and sit down, have a cup of tea and chat, will actually help the older person keep their brain going.
Sure. I mean, before we go further, the one thing I wanted to ask is, because I am fascinated by brain health. As you can see, I really like this topic. So, I have heard and learned, like, even as simple as keeping, when you're climbing up a stair, instead of right foot, if you put the left foot, or do something different or learn something different, it will definitely increase the neuroplasticity, or, increase the brain health. You are the expert, Arani. So why does it happen, and what can people do in day-to-day life to do something different, and how it will improve their brain health, please?
So that word you use, Menaca, plasticity, is a really good word, and that is exactly what the brain does. It can adapt. So we have nerves. If we think of nerves like electric wires connecting to other electric wires, if there is a problem in one tiny bit of the brain, the electric wires will form connections with other electric wires, and therefore you learn to do things a slightly different way. Now, how can we train our brain to do something? It's very hard, actually, because when I give advice, I always like to base it on evidence, and it's a slightly it's a more sort of evidence-free zone, really. But I think theoretically, the thing is, if you use different parts of your brain as much as possible, you're not letting a part of it die away, then if one part does become more affected by something, then you can draw on another part. So I think what you're talking about, which is sort of what we call executive function, or shift changing. So our ability to change the way we do things actually becomes less and less as we get older.
Okay.
I don't know about you, but I only have one way to get to work, and that is the only way. And if there's traffic, then I feel very, very upset, because I hate taking any other route, because I've got all these things going on in my head, and it's automatic when I drive, and I don't like to change the route.
Yeah, so true, isn't it? We are always in the autopilot mode, isn't it? We just put the...
Exactly, but actually taking a different route might help our brain adapt to a slightly new and different situation. So learning to adapt is always, I think, a good thing to practice, because you never know when you have to depend on that.
Sure. I mean, I never knew. I only got to know this couple of years back. I never knew about these things. So sometimes now I'm climbing up the hill, like, okay, fine, let me put the next foot, or let me try writing with the left hand and see what happens. But I really don't know, is there evidence, or is that, I have heard about it, I read about it, but, I thought I'll put it to the expert and ask your opinion about it. Thank you, Arani. So, and also, like, I think whether it may be dentistry or medicine, it is, I think, important for people to see things holistically, isn't it? It's just, just not the tooth, or just not the kidney, or just not the brain. Do you agree with it? Like, would it be better for people to look at these things a bit more holistically and see as a person how they can improve their lifestyle?
Absolutely. That's what we always try and do with our patients, because, just because they come to us with a single symptom that we might localize to the brain, it doesn't mean to say that they have all these other things that are going on that can impact on that. And, if you think about those 5 things that I mentioned about what each one of us can do individually, that's just not going to impact on the organ of the brain. It will also impact, exercise and good diet, etc., will all also impact on your cardiovascular health. So, the health of your heart, it will help with diabetes, it will help with so many things. It will keep your joints, if you're doing exercise, it keeps your joints all more flexible. So absolutely, I think these things will help you as a whole, rather than just your brain.
Sure. Thank you so much, Arani. So all of you who are listening, there's no excuse not to improve your brain health from today onwards. So going forward, can I ask, like we know now how to improve it. So we know, as you mentioned before, we know friends or family who have neurological disability, or I was told, we shouldn't call them special need, or, there are so many different terminologies. However, what can we do to help them as friends or family if they do have a neurological disability?
I think that's a really pertinent question, because I'm sure, as I said to you in the beginning, it's such a common problem, having brain disorder of some sort, stroke or Parkinson's, dementia, all incredibly, unfortunately common, that we probably don't have to look very far within our own little circles to know someone who has this. And I think if you think, how can you help that individual? If you know that individual themselves, then, trying to understand the condition. Because sometimes we can be quite impatient if people, I don't know, can't remember something, thinking, are they just doing this on purpose to irritate me? But understanding that actually this is a disorder, they have no control over that symptom, and that, we can help. By understanding it ourselves, we can help them. So I think that's the first thing, is to sort of understand the condition. And then the second thing really is ensuring that that individual is taking all their medication and doing what the doctors have advised them to do. And if they're not, finding out why, and if there's anything you can do to persuade them to do that. So for example, patients who've had a stroke, who've got diabetes, are they taking their diabetes medication? Are they controlling their diabetes and their blood pressure? And then I don't know what the audience thinks about all of this, but the next thing I was going to suggest is actually contacting the very great charities that we're lucky to have in this country. There is the Stroke Association, there's Age UK, there is the MS Society, there's Parkinson's UK. There are so many charitable organizations who have support groups, who can, who have people in them who understand exactly what you're going through, either as the person who's suffering from that condition, or as a family member, a close family member, or even as a not so close family member. And actually, we all know it's great to have support from other people. The support groups within the charities.
Of course, we are blessed, like you said, we have these support groups here. So I think I perhaps would ask you to elaborate two things. One is, of course, here, people who are here, how can they, reach out, and how we should promote these things and make everybody understand, these things are there to serve a purpose, and everybody should make the most of it. And I think on the other hand, like people who are from Sri Lanka and India, as a family, if those things are not so well established, what can the immediate family and friends do in their own capacity? Nobody's asking you to go and get trained to do it, but is there anything they can do in their small way?
We don't have that community as much, possibly because the distances are greater and we don't have that sort of village atmosphere, unfortunately. But I think, I think the thing that people do in Sri Lanka more than they do here is probably put aside the time for family. And actually, that is the simple thing that I would suggest, is that we put aside some time. Here we call it respite. So, but, you know, in Sri Lanka, you wouldn't even give it that name. You just do it, which is, you know, if a family member had a stroke, for example, and, you know, the husband had a stroke, the wife had to go and get their shopping done. They wanted someone to come and sit with the husband while they went out to get their shopping done. Well, that may happen without too much thought in a close-knit community, whereas here it might need a bit of planning. And so I just think if you can, you know, to spare that bit of time for close family and then they can always plan that.
Sure. I mean, thank you so much, because, you know, as you perhaps know, a lot of the younger generation, of not so young generation anymore, we all have moved out, and our parents are like you said, the social support is amazing there. I mean, I have had my father fall ill or mother fall ill. It's like it is a responsibility of the whole town. You know, they will be there and they will do the, you know, you don't even need to go to shopping to ask somebody to be there. They will do the shopping for you and bring it home. And, you know, it's just, you have to just tell it, isn't it? Those things. But however, I think perhaps they're not that equipped is how emotionally or socially, how they can support. You know, physically, I think they're very well equipped to do, like you said, exactly. But emotionally, is there something they should be aware of how to handle these things? Because I think, is it more likely people go into a panic mode and, you know, that kind of, and they're not aware, I guess, you know, you said the fact, you know, the face, perhaps people are not so aware. I think as a community might be, that is something we could do to bring more awareness there.
I think that's a really good point, Menaca. And this is what I was implying with the increasing our knowledge. Because if we knew and we taught ourselves about the condition, then we would understand it better. And therefore, we wouldn't have such a huge emotional response to some of the symptoms. And, you know, this is, if you go, for example, to the Stroke Association website, there are information sheets for patients and their families in Tamil now, you know, so there is a lot of information out there. We just have to find it and educate ourselves. And I think that would go a long way to being able to cope with it better.
Sure. I mean, thank you so much. I think I, for one, for sure, will perhaps get some of those leaflets and share it with people who are living in Sri Lanka and India, because I think it will be very, very useful. Because I know a few years back, my dad had the stroke, as I mentioned, and luckily on the day I landed there, and the same day, and because, you know, I think people are really not aware of it, because there was some housework going on. I told my mom, it looks like, you know, my dad's is not walking right. You know, you just feel it sometimes. But obviously I only go once a year, and my mom said, no, he had some injury on the foot and must be. I said, okay, fine, because dad's being dad's, like, he went shopping, he came back, and, you know, but as soon as he couldn't walk, it's not only the immediate family, it's only my mom was there at the time, but I feel that everyone around just go into the panic mode. And, you know, luckily I was there, and I just said, okay, fine, let's take him to the hospital immediately and get it. And some of the towns are not very well equipped for these things either, unfortunately. So, you know, I managed to take him to all the way to, but people only if they're aware of it, because, you know, as soon as you see someone, like you said, that they're not walking well, or their speech is slightly slurred, then, you know, those things, I think it's so important. I think we are in a very privileged environment in that case. But even here, I think it's really, really important for people to spread this knowledge and awareness, isn't it, Arani? And I think I can't think of anyone better to do this than you, because you know so much more. You know, I can only read and listen and tell somebody. I don't know much about these things, really.
So, no, I think everyone has actually quite, there's a lot of desire to know, there's a lot of desire to learn. And I think that's a and that's why I think actually we have failed as the medical profession, is actually to signpost to all these great bits of information. And especially, you know, seeing all of you here on Zoom or Facebook, you know, everyone has access to the internet. This is a vast amount of knowledge and resource, and we just have to use it appropriately.
Sure. Thank you so much, Arani. I have learned a lot. I'm sure our audiences have learned so much as well today. So, you know, immense gratitude. I know you have a very busy schedules, and thank you so much. And you took the time to have a chat with me. And so, you know, really, really humbled to have you.
Thank you so much.
Thank you. Just before we finish your session, is there anything like you want to tell people, to 2 or 3 things just top of their mind when they go home today, and share it with other people as much as they possibly can?
Number 1, please take your tablets if you are prescribed them. And if you don't want to take them, please discuss it with your doctors so that they can tell you, you know, give you an alternative. Number 2, please do some exercise. I know most of us have a phone. There's a health app that I'm just trying to bring up on my phone, and you can sort of see, I don't know if you can see it, but it counts your steps for you. So I would set yourself a target, and as you can see on mine, I'm not very good. I should have 10,000 steps a day. I do not make 10,000 steps a day. I almost do. My average for the last week was 6,376. So I am not good, but I'm trying to be better. I've now dumped my car and I'm walking and taking the train and walking to work in an attempt to increase my step count. So, so number 2, please do some exercise. And number 3, I don't know how many of you out there are of the younger generation. I've taken the liberty of putting myself in that. But I think if we can spare some time for our very knowledgeable, very experienced, wonderful older generation, to spend some time with them so we learn from them, but also we reduce any social isolation. Sure. So those are the 3 things. Thank you, Menaca.
Thank you so much, Arani. You know, I wouldn't even dare to share my steps. I do have an app, but I think I better start walking more before I share my. Next week, we are going to have emotional intelligence with Venkat VM Lingam. He's an international trainer of emotional intelligence. He is a director of Scholars Alliance. He works and trains in Malaysia and Singapore. So thank you so much. Hopefully we will see you next week again. But before we finish it, I am handing over to Dr. Kanta Niranjan to give a word of thanks.
On behalf of Meet Menaca, I'd like to congratulate Arani for an excellent talk today. I know you for a long time, and I take the privilege as a senior person about you, watching you in many venues and many places. You have done a very good talk today within a very busy schedule. As an NHS doctor, being on call for a acute stroke unit, I know how it is very busy. Not only that, as a doctor, you as a mother, young children and wife, daughter and daughter-in-law, you have been doing all the duties well. I'm really privileged. We have here today for giving a very good talk, and some of the opening points and clues or some ideas to keep our brain active in advising, and also in advising how we can get help. It's a wonderful speech, and thank you very much, Arani. And I know a lot of people will have a lot of questions to ask, so I leave the floor open for that.
Sure. Thank you. Thank you so much, Kanta. So as you said, this question started coming a long while ago, so I'm just going to put the first question. The first question to you, Arani, from the audience is, is stroke more common to a particular group of people?
Really good question. And the simple answer is yes. So, so if we look at age, firstly, so as you get older, the risk of stroke increases. But if you look at different ethnicities, so Asians, Afro-Caribbeans, Africans, they all have a greater risk of stroke. So yes, unfortunately, we have to do something about that. And if you look at actually the WHO data, the rate of strokes is getting worse and worse in Sri Lanka, for example, predominantly because hypertension and diabetes are not controlled, the rate of alcoholism is going up, and obesity is going up. So whereas it is not so steep in this in high income countries because those risk factors are being managed better. So we have a lot of work to do, particularly with primary prevention, to impact on the stroke incidence and prevalence in that group.
Sure. Thank you so much, Arani. The next question for you is, with post-menopause in women, how to avoid brain fog?
Really good question. I don't have an evidence-based answer for that, I'm afraid. It is a very recognized symptom. And I think it is going back to basics of trying to work out what triggers the brain fog, if there's any trigger. Sometimes for a lot of people, that brain fog is actually associated with migraine. And we know that there are two peaks to migraine. For those of you who don't know, migraine is the commonest cause of headache, and brain fog is a very typical symptom of migraine. And actually, the two peaks for migraine are when hormones are changing as you're a teenager, and then again as hormones are changing during menopause. So so brain fog can be a big issue. So it's going back to basics of trying to look at sleeping properly, eating regularly, drinking 2 or 3 liters of water a day, and reducing stress to try and regiment your lifestyle so that the brain fog is reduced as much as possible.
Sure. Thank you, Arani. Thank you so much for mentioning migraine, because I suffer from migraine myself personally. So do you think there's a connection between migraine and brain health?
Absolutely. Migraine is, as I said, the second most common brain disorder. So if we think of brain disorder being the inverse of brain health, you know, people with migraine actually cost this country a lot of money because they take time off work. And, you know, we can't have that because we need your taxes to fund the NHS. So it is a big, migraine is a big problem. And there's a lot of research going into migraine. So there's lots of medication options, but I, again, prefer the lifestyle options.
Sure. Thank you so much. I think I'm going to fit in one more question now, and then after we come off live, we'll continue with the questions. Obviously, a lot of questions are coming through. How can someone help themselves if they have epilepsy to improve their brain health? I guess that's the question, I think.
So epilepsy, usually you would have seen a doctor, you would have been given some medication, and hopefully they would find the right type of medication to control your seizures. So the first thing is compliance with the medication. Have I lost you, Menaca? Can you still hear me?
Yeah, we can hear you, Arani.
Okay. So, you know, firstly, taking the medication and adhering to the advice given. If that doesn't control your medication, then speaking to your neurologist or GP to change the medication such that it does control it. And the vast, 2/3 of people, at least over 2/3, will be able to control their seizures on medication. The things that can upset control of epileptic seizures are, firstly, not taking a medication, secondly, drinking too much alcohol, and thirdly, not sleeping very well. So hopefully if you do those three things, your seizures will be controlled.
Sure. Thank you so much, Arani. We are going to continue with the questions after we come off live. Next week, same time, same place, we will be addressing emotional intelligence with Venkat V.M. Lingam, who is an international trainer and a coach in Malaysia and Singapore. And as I announced earlier, that from July, we would be going live on Sundays rather than Saturdays, as many of you have requested. For the next 2 weeks, please be aware, it will be at 2 o'clock UK time, 6:30 India, Sri Lanka time on Saturdays for the next 2 weeks in June. So hopefully we'll see you in the same place, same time next week. Until then, stay happy, be safe, and keep smiling.